Hi, good evening, everybody. My name is Hetal Doshi. I'm an organizational psychologist, and as I've been repeating over and over again, on the 30th of March, um, I was literally told, not asked, I was told to make sure that I do my part for the community by supporting everybody with regards to this interesting space called mental health. And because of that, thank God, because of that push, we've started a beautiful Facebook group with a lot of amazing people here who are like-minded and interested about mental health. And we have also every single day since the 30th of March been inviting professionals, experts, and also everyday heroes just like you and I to come on and share some of their stories that can definitely either increase our awareness, our knowledge, or at least give us some inspiration to keep us going in this interesting times. And today with me is guest number 41.
Wow.
Took a while to find him. Took a while. Yeah, took a while to find him. But I'm so grateful for this opportunity to have chanced upon someone as charismatic and someone as passionate in this industry, who, as you would hear in a while, is doing a lot of varied type of work in this particular field of psychiatry. But at the same time, also not just focusing on the field, but also advocating so that other people can understand the typically what it means and also what it doesn't mean when it comes to psychiatry and potentially well-being as well. So without further ado, I've got Dr. Amer. Some of you, or quite a lot of you, would have either heard of him or definitely started recently hearing more of him as what I did as well. Dr. Amer is a consultant psychiatrist for University Malaya and also wears many other hats. So, Dr. Amer, if you could, do share a little bit about who you are and the kind of work that you've been doing.
Yeah, so first of all, thanks a lot, Hetzel, for inviting me on this platform. I think it's been really interesting to be sort of sharing with a diverse group of people. We've had KL Pack at some end, and now we've got OPsych at one end. So it's been a bit diverse during this pandemic. Also, I think I've made a lot of friends. We've just had acquaintances now, and that's been really interesting. So I'm Amer. I'm a psychiatrist by training. I'm with the University of Malaya. I, as you've mentioned, hold a number of hats. So I practice in the University Malaya Medical Center as a psychiatrist, where I do clinics and on-call services for the hospital. I'm also attached with the University Malaya Specialist Center as a consultant psychiatrist, doing literally the same thing, but minus the on-call services. I'm also the chief coordinator for the University Malaya Center for Addiction Sciences. So my field of research is in tobacco control, tobacco research. So I'm part of a group of 5 or 6 of us doing addiction work in UMCAS, UMCAS. And at the same time, I'm in higher management of the university as the director of the Center for Community Engagement and Sustainability, which is the main center for the university in doing community engagement or CSR work between the university and the community and industry. So these are the hats that I hold within the organization. I also contribute time with Befrienders as the consultant, and also with the Subang Jaya Care Warriors, which is a local group in Subang Jaya doing work on mental health advocacy, awareness, and suicide prevention. And on top of that, I do stuff like what we're doing with you right now, which is just sharing on mental health and mental illness.
Oh my God, I am typing this out. My fingers are already hurting. I wonder how you even doing this. You obviously have grown really well in the industry and understood how to be an octopus, where you're very steady in your understanding of it, and at the same time be able to apply it in many different ways, which is awesome. A couple of questions. What are the biggest misconceptions about psychiatry?
Well, I think the first misconception of psychiatry is that they're not a true science. I think we have to understand that psychiatry is a branch of medicine. It's specialization, it's a specialist program in itself, where these particular medical doctors specialize in the field of human behavior. The difference between a psychiatrist and other mental health care providers is, number one, that they're medically trained from the very beginning. Their input in this field is actually looking at the various physical causes that might result in individuals manifesting with behavioral issues. At the same time, they're also trained in psychology, where they also have the outlook of the psychological model of mental illness, and are able either to provide with further training psychological support, or at least to understand and be able to refer to colleagues with the relevant specialist training for psychosocial support. The second misconception is that psychiatrists, are not doctors who have mental illnesses. Yeah, I think that's something that sometimes comes. The stigma that we have is like they're the same as their own patients. We are also human beings. We are going to be open to the risks of developing mental illnesses, just like anybody else. But there is no, there shouldn't be a stigma in the field of psychiatry because of that misconception. I think that's the other thing we need to put across.
Right. Did you say that the misconception is that psychiatrists don't get mental illnesses? Is that what you said?
Well, there's two. Either they're patients with issues of mental health problems. That's one. And this is a stigma that is often faced by colleagues trying to do psychiatry in the field. The second one is that people don't necessarily assume that we don't get mental health issues. And I think it's very important for everybody to know that just like any other medical profession and any other population, we're also at risk of developing mental health issues. It's just that I think the difference is that you have a little bit more training on how to assist yourself to prevent a mental health problem. But if you're going to get it, just like the rest of us, you're going to get it. It's just that it's a matter of how long in your lifetime are you going to get it, or how quickly are you going to get it.
Right. Oh, thank you for putting it out there. I think that's like a huge misconception. The fact that obviously we're human beings, and obviously we're human beings first, and that means that we're just as susceptible to anybody else as well. So yeah, that's really good to put it out there. When you say there is a misconception that we will not get it, what do you mean, like get as in like mental illness? And is this something that we get? How do we end up having mental health related challenges in our life?
Well, I think first of all, there's various types of mental illnesses out there. I think we've got to be very clear about that, and we can group them into themes, right? Mood disorders, anxiety disorders, psychosis, addiction issues, childhood psychiatric conditions, old age psychiatric conditions. So there are, it's a spectrum in terms of age. It's also a spectrum in terms of types of illnesses that you can actually get, if that's the word to use. So often when we look at the etiology of mental illnesses, you're going to have biological causes as being one of the causes of mental health problems, mental illnesses. And this could be like what we call genetic loading. If an individual has a lot of family members with certain mental illnesses or a mental illness, they're at risk for developing a mental illness. Sometimes they could be grouped together. Sometimes it just increases your risk a little bit. The theory behind that is that there might be some genetic issues with regards to maybe the receptors that we understand to be causing individuals to have problems with mental illness. Or it could be the level of susceptibility in terms of your the way your brain is formed, or the parts of the brain that might be affected. So that's one biological cause. At the same time, biological causes are going to be quite susceptible to influences from outside. For example, the introduction of drugs early on in life. And you could either call that a biological issue or a social issue, because people who take drugs can actually increase their risk of developing a mental illness. Of course, other psychological issues that might entail things like early childhood trauma, whether it is abuse or neglect, or whether it is in fact blatant abuse, could increase risk. You've also got the issue of the arrangement of people living, where certain living conditions, particularly issues with poverty, might increase risks of people who have a risk of developing mental illnesses. So, there is the element of biology, psychology, and environment that comes into play before an individual might get a mental illness. Now, the mental illness is the far end of the spectrum, but before that, you can have mental health issues, and mental health issues include symptoms of mental illnesses, things like anxiety, depressed mood, avoidance, for example, could be sort of early manifestations of individuals that might develop a mental illness, per se. So
Okay.
it's really a diverse range. So, going back to who helps people with this, and this is where we have the various um, healthcare providers in mental health, mental health care providers. So some of them will help you at the very beginning of your condition. Some of you will help you in the middle of your condition. And then there's going to be a group of them that will help you at the very end of your condition. And often at the very end, they get a lot of the contributions by all the mental health care providers, all in all, helping out.
Yeah. Okay. Is which part is the toughest? Is it at the start, the middle, or the end? Which part is the toughest with regards to reintegrating from the onset of a particular challenge that they're going through? Which part is the toughest?
I think all parts are actually quite tough. In fact, I think the beginning part is a bit harder than the end, because the end is very clear. It might be very clear what we're dealing with, right? So an individual diagnosed, for example, with the condition called, say, bipolar mood disorder. If you're at the end, you're going to have the extreme end of your illness. You're going to be probably brought to hospital because of your symptoms. You're going to be seen immediately by the right people.
Okay.
At the very beginning, you might have symptoms, but there's not very clear. There's going to be a lot of miscommunication. There's going to be a lot of misdiagnosis, or even misplaced trust in the people that they need to see. And I think this is where the element is actually hardest. This is also where the bulk of the work is. The awareness that we do is trying to get people early to see professionals if they have a condition before they're at the end. Because you're able to alleviate the symptoms, then the diagnosis will overcome. Right?
Yeah. Right.
You're going to be able to do things at the very beginning, avoid things like drug use, for example, if you have family members or what have you, and you might not even get to the end. But if you allow this person to go through without being seen, then of course the whole journey comes in, and then they will be diagnosed with a mental illness, and therefore sometimes this is where a lot more work is done, and stigma comes in, and lots of loss of functioning is also seen. So we want to actually end, and we have to put a lot of money at the very beginning. But unfortunately, I think we're putting enough money at the very beginning, so we're seeing them at the end.
Right. Okay. So who are the general what is the general profile of people that you particularly meet with?
So as a psychiatrist, I'm at the end because we're in the tertiary or at least secondary level institutions. We're mainly seeing people that are, number one, symptomatic most of the time. Number two, with major functioning problems often. So often our cases are going to be brought to us by family or friends, or sometimes by the authority, depending on how they come over. So we're going to be in the business of treating these individuals with a diagnosable mental illness most of the time. Now, in other countries where the system is more robust, the psychiatrist works very closely with the clinical psychologist and the counselor, together with the social worker and their psychiatric nurses. But in our country, some institutions might have such a program. Most actually do not have full colleagues in mental health care provision. So it's a little bit more challenging because when you're dealing with a person with a mental illness, you're not just dealing with the illness itself, you're going to be dealing with the whole person and everything that comes with the person, his family, his lifestyle, his employment, his future, his past. And I think if you're wanting to do a really, really good job with this person, you need to have all the players involved for you to be able to provide that. If you don't have them, it's still okay, but at least the psychiatrist or the colleagues needs to know who to refer to. And I think we had that discussion at the very beginning of this individually, where the problem also with the lack of awareness about mental health care, people don't know, number one, who to actually get their family to see. Uh, Sometimes colleagues are not aware of the other colleagues that are in the vicinity for them to refer to. This is where there's a missed opportunity, I think, for better care to be given for
Yeah.
our patients.
Yeah, absolutely. And why is that the case? Why is it that, you know, uh, with so much more awareness in the past few years, and I know it's not your fault, so I'm just asking generally. Um, Absolutely nothing, nothing. It's just a general question that uh, psychology has, or psychiatry definitely has evolved. It's getting a lot more traction. People are becoming more aware about it. There are rising, escalating, exponential increase in number of people who need such help. Um, why is it that it's still so hard to find the right psychologist or psychiatrist or counselor, and also be able to have an enjoyable treatment of sorts, where you are partnered with somebody that you like, that you really click with, because this is a journey. So obviously one of the most important things is that you get a chance to make sure that you're kind of partnered with the right therapist or psychiatrist of sorts. So why have we not gotten to that stage yet, you think?
Well, I think Hetal, it's got a lot to do with it's still got to do with awareness. Yeah. First of all, I think the awareness about mental health problems in general is still not that great. Look at the data for health literacy. Health literacy in general is also not that great, about 6.6%, according to the National Mobility Health Survey. So if the health literacy itself is not hell of a grade, definitely the many aspects of health will also take a hit. And as I said at the very beginning, mental health care in general has always been stigmatized in various forms. Yeah, in the way that we discuss about people, he's pussy, for example, or he's crazy. These are all stigma about mental health care. So anybody who feels that they might have an issue because people are saying that they might be crazy, therefore,
Yeah.
there's that avoidance for them to be crazy in that sense, right? But that word itself has a lot of symptoms, and some of the symptoms are a lot that we've actually felt during this COVID period, right? Anxiety, depressed mood, fear, phobias of certain sort. Does that mean you're crazy? No, it doesn't mean that you're crazy. It just means that you've got symptoms that, if you do not know how to deal with it, it might be a problem later on. But most of the time, it's going to be normal reactions towards the situation that we're in, right? But you need to understand that what is normal and what is abnormal. So once you have that issue and you understand that, then only can you actually find the right help. Now, the help itself is a little bit difficult to find because there has been a lot of confusion between who the psychiatrist, a clinical psychologist, a counselor. Our social workers, counselors too. So there's all these questions about who these players are, and therefore for the person who's looking for help, who do you go to? And what can they provide for you? Because there's also this misconception in psychiatry that if you see a psychiatrist, you're gonna always get medication. If you see a counselor, you're gonna get advice. And I think it doesn't do justice because all these people have a part to play in mental health care. but you need to know what they do. And I think there's a bit of it that's it's because of all of us. We don't maybe share with people before this what we actually do for a living anyway, how we can actually help. A lot of us assume that people might know what we do, or maybe we're waiting for them to come because we're set up in a system where we're going to get driven a certain group of people, right? Like I said, if I was just practicing in the lower end of it, I'm just waiting for you to come when you're mentally ill severely, and I'll treat you. But I decide to go forward at the very beginning of the food chain and do some advocacy work.
Yeah.
So if you're just waiting, it's easier. If you go in
Yeah.
front, they get confused. But at the same time, you get a little bit more awareness about the work that you do. And if you're fair to other people, you actually promote the various mental health care providers that are out there and the work that they do so that people can make a choice. And also, similarly, in terms of health, you're spot on just now, Hetal, that for mental health care, it's a journey just like any other health issue that you have. So if you have Dr. A and you don't like Dr. A, you can actually find Dr. B. Now, we're assuming that Dr. A and Dr. B are highly competent because they've been trained well. For example, if you want to see my colleagues in cardiology, who holds the title of a cardiologist, you would have the assumption that they're trained well to become experts in the field of heart medicine. So your personality might not suit Dr. A, cardiologist A, because of whatever reason. There's an opportunity for you to actually find Dr. B. It's okay. So the same thing with regards to psychiatry as well and mental health care, that sometimes our relationships don't click. And the patient has an opportunity to share this with his or her therapist, and hopefully that therapist will be open enough to refer it to another person, or at least to be honest in their conversation about what they can do and what they cannot do, or when they can be able to refer. I often have this discussion with my patients as well. If I come to a point where we're not moving anywhere, I'll refer them off to somebody else. Or feel that our collaboration is not working because of a personality difference. And I think my colleague, is a better fit. I call it a fit. Then I would often off to my colleague for their mental health care provision.
Yeah. Right. I love what you say because I love this part that you said that it's our fault. It's our fault as professionals because the responsibility is no longer anywhere else except in our professional standards. That it is our fault that we don't go out there and share precisely what it is that we're doing. Purely because it's a service, it's not a product. Products are easy to explain. Services, much less emotions, are very difficult to explain. But if we can't explain ourselves, then obviously, we need to take responsibility for that. And like you say, it's at the front line where we're chatting with the community. And once we chat with the community and they have these questions, together we can kind of expose a lot of these things where it's either doubt or misconceptions or just basically lack of knowledge. But it's only when there is a connection with the community and we are at that level, only then can we begin to raise awareness and bridge that gap, and also maybe explain what these services are in less of a technical format.
Up until that's exactly true. The technical format is the other problem, right? We organize a lot of our terminology until we don't understand what we're talking, and of course, definitely our patients and the people that need our help have no clue whatsoever.
They're like, what are you talking about? And I think there's a huge space for us to kind of come together as professionals and really do our part and in servicing in an appropriate manner as well. And I'm just so glad that you're doing a lot of that as well. We have a couple of people saying hello, good evening. Sorry, I tend to totally forget about you guys. I just get so immersed in conversation. I'm just terrible at just getting out of that zone. Sorry, good evening, and thank you so much for being here. Please put in any questions that you might have. Thanks a lot for being here as well. Okay, so I thought maybe one of the things that we could do today would be also to talk a little bit about this spectrum, right? And I thought since you're a psychiatrist, and I'm an old psych, and it's different spectrums, I thought maybe we could hash out this word mental health, because even when I was coming up with this group's name, I wasn't happy with the word mental health, because
Yeah.
what is that even? Like, to me, it's like such a broad thing. It's like just saying health at work. Well, what does that even mean, right? But there is a whole spectrum that you can speak about with regards to mental health. So I thought, since both of us were here, then maybe um, how do you explain this concept of mental health? How do you explain this
Well,
concept of mental health?
yeah. Well, for me, I'm using the WHO definition for mental health, which is basically the ability to, number one, manage stress, number two, reach potential, number three, be productive, number four, being able to contribute to society. So at any point, if you're going to have a deficit in these areas of your life, there's a possibility that you might be having a mental health issue. Now,
Right.
mental health issue doesn't mean that you have a mental illness. It just means that you have something that might shortchange you in reaching your full potential. And that's why at the very beginning, if you have mental health issues, there are certain colleagues of ours, like counselors particularly, which are almost like coaches. They do a lot of positive psychology that might able to get you through that little bit of a rut.
Right.
Now, if you allow that mental health issue to percolate and continue, then individuals might have what I call as distress, where they will have some functional loss, and often you might need more support from other colleagues like the clinical psychologists. And you allow that to percolate even further to the level of impairment where you're having full functional loss. You're unable to reach your full potential. You cannot manage your stress at that point of time. You are not productive, and you definitely cannot contribute to society. Then, therefore, you're going to be probably seeing people like the psychiatrist or the clinical psychologist with special, skill sets.
Yeah.
So that's how I look at the issue of mental health.
Okay. And I would like to, maybe, if you could, between us, we may understand the word functional. What do you mean when you use the word functional?
So when I use the word functional, I'm looking at the ability to function as an individual, i.e., the productivity issue that we're talking about just now, and also as a member of society. And that could be as a parent, as a child to a parent, as a worker to an organization.
Yeah.
That's where I'm looking at the word functional in that sense. So
Right.
if you're going to have any loss in these areas, and it's related to behavior change or a psychological aspect, then it's more likely than not that you're going to have a mental health issue. If you're going to have a loss due to, say, a physical illness like a loss of limb, then it's going to be a physical health issue that we often talk about. So when we look at the WHO definition of health, you need to have physical health, mental health, and social well-being in order for individuals to be holistic in their health. So in any part of that spectrum, either you lost a leg or you sprain your leg and you're unable to, say, play football. If you're a soccer player, you're unhealthy. So same thing with us in mental health. If you have been introduced to a lot of stress and you're being unable to control that stress, or you're symptomatic, which results in you not being able to perform at your best level, therefore you have a mental health issue. You're
Yeah.
unhealthy.
Yeah.
If you're having problems at home and your social well-being is affected, where you're unable to perform at work, then you're technically unhealthy in the societal issue, and therefore that needs to be addressed by the right people.
Right. Right. Okay. So, with the body, it's kind of easy to understand where the pain is. Like, okay,
Yeah.
yeah, it might be a problem with the kidney. That's the health issue, right? So I can understand, okay, initially I'm feeling like there's something wrong with the kidney, maybe on the side. And then if I don't go to a doctor, it becomes worse. And then it's completely not functioning and I have to go get it checked out. Maybe there's a stone, I need to take it out. But with regards to mental health related issues, what are the body parts that we are talking about, and how do we understand this concept that, in our opinion, I mean, as a lay person, okay, I have a brain, these emotions are floating around, I don't even know where they are. But how would you describe it so that people can understand it like the physical body, or in a more tangible kind of a manner?
Okay, so for us, the body part will definitely be the brain, but like I said, for psychiatry, as medical doctors, there are many parts of the human organ that might also mimic mental health symptoms, and they might not necessarily originate from the brain. I'll give you a very classic example. It's going to be the thyroids, which are right here in the neck. If there's a dysfunction of thyroids, whether you're going to have an increase in thyroxine, which is a byproduct that is produced by the thyroid, or there's a lack of thyroxine, you might manifest in mental health symptoms. So individuals that are seeing us, for example, needs to be thoroughly checked, and that's why when I do my sharing with people, we often talk about taking a history, doing a mental state examination, and for some of us, we actually do physical examinations and also do investigations for that particular patient, because there might be a manifestation somewhere else that might result in the symptom that we're seeing at that point of time. So, how do you know that you might have a problem? Often we're looking at behavior that is fairly consistent. And when there's a change in that behavior, whether it is from one end of being inactive or to the other end where they're extremely active, or they've just lost it. It's a total incoherent change of behavior, totally different change. Then we feel that it's probably got a lot to do with mental health issues.
Right.
Secondly, is about rational thinking. When there is the inability to comprehend and to rationalize certain arguments, certain behavior, therefore the individual might also be manifesting mental health symptoms that probably warrant some level of investigation. Now, the brain is a dynamic organ. It controls every part of the human system, and therefore sometimes if you have a deficit in the brain, you're going to have certain dysfunction in the other parts of the system, which also might be related to us. But often, because as you mentioned, if your hand is suddenly not moving, for example, you're probably going to be seeing somebody that you think is going to be related to the hand or to the arm, right? But sometimes when they've done all the investigations and the investigations come back normal, then often they might refer them to us to see whether there is a psychological reasoning why this person's brain is not doing what it's supposed to be doing.
I see. Okay. All right.
And sometimes we do certain interventions there as well to assist.
Okay. And with regards to assessments, because there is a lot more conversation about mental health related issues, and also a lot more conversations with those who are even highly functioning. Are there any assessments that people can take just to understand whether they are doing okay, or whether they need to be?
Probably you're a bit better than me in this, because the other thing about psychologists, if people don't know, clinical psychologists in particular, are actually very good at psychometrics, where they do lots of certain psychological testing, which are able to understand human behavior a little bit more. And often these testings, and they could be from temperament up to frank mental illnesses. And some of these particular tests, these psychological testing, are able to detect with some level of certainty whether this person might have an issue or not. And if you put it together with all the other investigations, then we might have a better picture of this particular individual. So going back to your question, yes, there are certain tests that individuals can do. Personally, we don't normally recommend that you do them just for the sake of doing them, because there's something called false positives and false negatives. And it also depends on whether these tests are what we call screening tests or they're diagnostic tests. So if it's a screening test, it's often going to be a test that is able to have some idea that you have a problem, and then you complement it with what we call a diagnostic test, where if you come in with a certain symptom, then individuals will be able to pinpoint whether you've really got that problem or not.
Right.
If you do the wrong test, you might have something called false positives, where you'll be seen to be positive for a mental health problem, but you actually don't have anything, or a false negative, where you might actually not have, you'll be told that you don't have anything, but you actually have something. So therefore, it's really important for people that have suspicions of whether they themselves or their family members have a problem to seek the right help.
Okay.
And mentioned
Yeah.
just now, probably the first point of call could be our colleagues in clinical psychology or even psychiatry, where we'll be able to help you and guide you whether you need to see us or somebody else in terms of their mental health care.
Okay. So just while we still have you here, how does somebody make an appointment with someone like you or your colleagues at maybe I'm not sure, but if somebody's watching now, how do they get support? And is there a place where that you are connected with that they can get support?
Okay, so if you go to my website, which is not sadly not updated, I think I should update it. Mentalhealth.my. We've listed all the support that individuals can achieve. If you go to the Malaysian Psychiatry Association, there's a list of all the public and private psychiatrists. If you go to the Malaysian Society for Clinical Psychology, if I'm mistaken, they've also got a list of accredited clinical psychologists that you can visit. And also there's a group called ProKema International, ProKema International, which is the counseling or even the counseling board of Malaysia. They also have a list of all the counselors that you can actually see if you feel that you need their help as well. Now, there are certain NGOs like the Malaysian Mental Health Association, which can also assist you. If you need immediate psychological support and you're calling Defenders Kuala Lumpur, they can also at least give you the relevant websites for you to find that help. And finally, the Mental Illness Association Support Association, MIASA, also has people that you can actually see if you have a mental health problem that requires further intervention.
Right. I was going to put up a banner, so I'm just going to double check one more time. Is it the Malaysian Society for Psychiatrists or Malaysian Society for Clinical Psychologists? Which one was that again?
Two. So the Malaysian Psychiatry Association is one.
Okay.
I think the other one is the Malaysian Clinical Psychology Society, if I'm not mistaken.
Okay.
And then the third one is going to be the Malaysian Counseling Board. Or the other one, there's another group, they call it, I think it's called ProKema International.
How do you spell that? P-R-O?
P-E-R-K-E-M-A, if I'm mistaken. Or P-R-K-E-M-A, ProKema, I think, ProKema International.
Okay, so I think we have a couple, those of you who are seeing this, please don't mind the spelling errors and maybe just try and play around with it a little bit. And hopefully it helps a little. Otherwise, please go to Dr. Amer's Facebook page and just message him, and I'm sure he'll be able to guide you. So I also wanted to maybe just check in with the last thing here. So Dr. Amer, if you were the Prime Minister of a country, and you knew that with the digital economy or what the economies are striving for, coupled together with rising cases of mental health related issues, whether it's because there are more people reporting in general or whether the fact that it's actually increasing, but regardless, it is increasing. What would you do if you were the Prime Minister and you knew that together with economic development, there is an increase in mental health related issues? What is something that you would consider doing?
Well, first of all, this is not a hypothetical case. This is a real scenario that we're facing with. My prediction is that we'll be struggling with mental health crisis in Q4 because we know that the COVID pandemic is going to cause a lot of economic strife. In fact, on Twitter, just before coming on, I've been checking. People have been reporting that they just lost jobs, sadly, about a week before Hari Raya. But I think this is to be expected because of the necessary measures that were needed during the COVID pandemic recently. Sadly, people had to lose jobs along the way. So this is not going to be something that is isolated. It's going to continue. I mean, it's predicted that 2 million jobs might be lost. So economic issues definitely contribute to mental health care. Yeah, financial health equals to mental health. If you have poor financial health, you're going to have poor mental health. And we've seen this over and over again, particularly in periods of recession. So the good thing about this particular situation that we're in, if there's a good thing, is that we sort of know that a recession might come. We sort of know that an economic issue will be happening. So there are actually things we can actually do now. So first of all, I think the first thing is to increase levels of mental health awareness. I don't think it's at the level that we would like it to be. There's a lot more opportunity for us to do so. Second is to still maintain the MHPSS, the mental health psychological support services that we had during COVID. Don't cancel that service, which includes the Ministry of Health and 18 NGOs involved, where they were taking care of people that were either infected with COVID or frontliners who were fighting against those with COVID, or those who were struggling with the MCO that we're going through. So mental health, in fact, support it further. For example, fund people like befrienders a little bit more so they can have their lines open, waiting for the time when people need their services more, right?
Yes.
The other thing is also to start having a discussion with the relevant mental health care stakeholders. There are many mental health care stakeholders out there that I've shared at the very beginning: psychiatrists, psychologists, counselors, social workers, psychiatric nurses. I think the government needs to have a discussion with these people at the Ministry of Health. At the same time, the Ministry of Health also needs to have a discussion with the other ministries like economic, youth, employment, because as you already mentioned, they all need to be prepared for a mental health crisis, which lots of researchers internationally are predicting, because COVID, the pandemic, actually affects all countries.
Yeah.
And we already see some of the complications of if you don't do something about it, which is suicide. And we want to prevent people being in a certain situation where they're either, number one, desperate, or number two, really unable to support their stressful symptoms, and later becomes an issue to the point we lose lives unwantingly. So I think there's this opportunity for us to do those things just now, which are also evidence-based. It was recently published in a Lancet paper that one of our own, a colleague of mine, Dr. Chan Lai Fong from UKM, was one of the authors of that paper. And there was a paper of 26 experts in there which gave recommendations for countries to actually adopt to prevent a mental health crisis in the latest stages of the year, if not early next year. So that's what I would advise, the people above.
Yeah, and I think what you have put out really well over here is not just the Ministry of Health, but the Ministry of Economic Development as well. Because if you're going to have an economy with people who are suffering everyday people, just like you and I, who are suffering potentially mentally, or we have to support people who are going through this in our families, what kind of an economy are we going to have? And absolutely, like what you've said, the youth as well, because they are experiencing this in somewhat of a prime time in their lives, and that's definitely going to project into the future of theirs as well, including children, not just the youth.
Yeah, so you're right. We're going to have things like the Ministry of Women's and Community will be another potential ally. We will need the Ministry of Internal Affairs, because the police are under them, and the police need to be supported during times of crisis. Because remember, in terms of economic strife, you're going to get people needing extreme levels of help. The police need to be trained so that they'll be able to give that help to the people and know where to actually send them if they need that support. So
Right.
it's an interagency, inter-ministry collaboration that we're actually needing now. And we
Mm.
know that it works because in this COVID, when the ministries all work together, we get a better response in how we're tackling our COVID pandemic at the moment.
Yeah, absolutely. And in your opinion, is there a segue currently into ministry level, government level, to be able to propose such things? And are you already trying to support some of these work?
Well, first of all, the Ministry of Health has what we call the Mental Health Promotion Board, where I actually sit in that committee, which
Mm-hmm.
is chaired by the Minister of Health. And
Mm-hmm.
therefore, we've been giving recommendations to the ministry about this. And secondly, we're seeing with a little bit more, so we're seeing a lot more support from inter-ministry. Tengku Zafrul, our Minister of Finance, I think during the Prihatin 2, he mentioned specifically that we got to be prepared for a mental health crisis. So there is a little bit of that narrative coming from MOF. We've seen the Ministry of Science looking at ways to provide, help for those using technology. This was YB Khairi Jamaluddin. We've had bipartisan support in terms of MPs. We've had, for example, YB Nurul Izzah having a couple of mental health FB live sessions. We've
Mm.
had students like YB Michelle also sharing. So people within the government
Mm.
from both sides are actually quite concerned about this. It's just that we also need to support them to be able to push those particular policies, which will be able to help all Malaysians in general. Because
Right.
health is something that everybody needs to be on board, right? The rakyat and the people who are in power at the moment from all divides. And I think this is where we need to at least share with them our concerns, which we have, through both mass media and alternative media, and of course, for some of us who are privy to have them as colleagues and friends, we can share with them their ideas, and hopefully they'll be able to share with their colleagues their ideas, and we'll be able to get a better solution.
Right. Okay. That's really fantastic stuff. I definitely wanted to understand what the phases are with regards to implementing any policies or implementing any support services, because a lot of it is still under NGOs right now.
Yeah.
I'm not sure whether they are backed up well by the government, but
Yes, I
definitely.
must not forget those NGOs, Hetal. You're right. They definitely are on board. And I think one of the proof that the NGOs are really very important is during this COVID MHPSS, where I said just now the Ministry of Health worked with 18 non-governmental organizations. Some of them you have listed under there. Another one that have been working together is Souls Health. And
Yes.
all of these people have come together to support the ministry in the mental health care for the Malaysian population.
That's so amazing. That's so amazing. Just hopefully it is. Hopefully they're really well supported and funded, because this is not an easy space to be working in at all, especially during these times as well. Because I know quite a lot of them are also experiencing a space within themselves that they're like, I can't do any more of these sessions already. That's just piling up like crazy. So yeah, this is where mental health professionals definitely need the mental health support as well. So we're running a little bit out of time now, but I just wanted to ask you, I wish that we had a bit more time. I definitely would, get in touch with you again, see whether you're willing to do one more session, but and maybe more personal one, really not about you and the work that you're doing, but more a personal story. But maybe next time. Is there an advice that you have ever been given or that you'd like to give out in this period of time for the people who might be listening? So is there any piece of advice that you'd like to give?
Well, I think first of all, we had, and I think it's still ongoing, the Let's Stop Minda Sehat campaign.
Mm-hmm.
And TALK is literally the advice that we want people to take on board. Yeah, T is for telling someone about your problem. A is for asking for help.
Mm-hmm.
L is for listening without judgment. And K is knowing where to find that help. And I think if there's something that I would like to pass on to everyone is to remember TALK, talk, and find the information, because you never know when you might need it or someone else might need it. It's a bit like doing first aid. When we were in school last time, they said please learn how to do CPR. You never know when someone might just fall down and need that help. I think more and more as we're knowing that there's going to be a crisis coming up. Yeah, again, I don't want to be fear mongering. If there's a crisis, we're ready. If there's no crisis, we're prepared.
Yeah,
But
absolutely.
I think to be oblivious to the fact that this is happening right now, or just denying that it's going to happen to us, is really irresponsible.
I think so.
So knowing TALK also allows you to know help when you need it, and also when your friend or family needs it, you know what to do. And I think this is where the work that you're doing as well, Hetal, in getting these kind of platforms up. 41 days, yeah, this is pretty amazing. If you're saying daily and you've got 41 people, that's pretty amazing.
That
So
is.
getting people to know where to find the relevant support. And I know you had a friend of mine, Hartini on board.
Yeah.
She's migrant children, and sometimes you listen to a story, also you'd be almost tearing.
Yeah, I can tell you that almost every session has made me cry. It's painful. Every day I'm just sitting here and crying, and I don't know why I'm doing it. But it's just amazing stories. It's not I'm not crying because of me, but these stories that I hear every single day from people is just super heartwarming. But yeah, sorry, you were saying that.
Yeah,
I
but I
love
think
yeah.
platforms is the one that we need to get this information across to many types of people. The one that I do caters for a certain group of people. The one that you're doing caters for a certain group of people. When all of us collectively do this, and like I said, I participated with KLPAC as well. They're a different set of people. But I think the more we're able to share this information, the TALK becomes even more meaningful. They can, they know when to tell the problem, they know when to ask for help, they know where to ask for help, and as a friend, they know that they should be listening without any judgment. So just getting on board TLK, I think, is more than enough
That's
for
so
us
apt.
people.
That's such an apt advice. I missed out the K. What is the K again?
Know where to find help.
Know where to find help. Okay, that's perfect. That's perfect advice from a psych. That is perfect advice. And I think we should definitely all get together at some point and definitely put together some kind of resource so that it's easy for people to just, be able to get the help that they need. Because that's the biggest problem that I'm seeing, that, okay, yeah, people are starting to talk about it. Everyone's like saying, yes, we should listen and blah, 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 but where do we go? We still don't know where to go. And who are these people that I'm going to be talking to? Who's on the other side that is going to be doing these services? What do they look like? Some of them have even asked me these questions. What do psychiatrists look like? And I just can't stop laughing, because I'm like, they just look like us. They're like, like, is it like the couch thing? Is it like, I don't want to sit on a couch. So there's all these myths and misconceptions about it. But, having
think they look like that, yeah? I don't know what the story looks a bit like.
Yeah, definitely. In a very smoky room, I don't know. There's just really weird things that I don't think it's their fault. I think it's just because of exposing. But, having met someone like you, if they've exposed themselves to someone like you, and the other day we've also had Dr. Prim from Penang Adventist. You might know him as well.
Yeah, I know him, yeah.
So just like, being able to like meet and like have, just an understanding about how you guys are so normal and cool, just makes it a lot easier. It makes it a lot easier. And I think the best part about it would be, for me, I think the best part of it is that one day people can hang out at a bar or at a restaurant and be like, oh, the other day, I had a good session with Dr. Amer. Oh, you went to see a psychiatrist? Yeah, obviously, because Dr. Amer, right? So it becomes like a thing that people proactively feel like, oh, I did a good job today. I checked myself to see whether I was in a good state and getting myself ready, like a marathon. I'm getting ready for the journey that is called life. So thank you so much for being here. I'm sure that whoever is listening in right now would have benefited significantly, and at the very least, I have. So I really appreciate your time. Really, really appreciate your time.
No problem. Thanks a lot, Hetal. We'll catch up with you soon again.
Yeah, absolutely. Good luck with everything. Bye-bye. Bye.
Thank you.